What is going on, everyone? This is Garen. I am back to just do a quick little topic about choosing between the bottom surgery, either going RFF, phalloplasty, or ALT phalloplasty. If you guys are not familiar with bottom surgery, this is a term that it's commonly referenced towards transgender individuals. And in this case, I am a female transitioning to male and have been transitioning for the last 10 months through hormone treatment. And my most recent dilemma has been which one to choose as far as bottom surgery. I know I've been stuck between, do I want to go ALT route, which is using your thigh, or do I want to go RFF, which is using your forearm? Both of them have pros and cons, to be quite honest. I've already underwent my consultation just last week and spoke to the coordinator that doctor works with numerous of times to really break down the conversation and deep dive into which one I would like to move forward with. Ultimately, my decision is to go the forearm route, which is RFF. And honestly, I was truly struggling between which one to choose. And the reason why is when you go forearm, you cannot predict the size or you cannot predict the girth. There is no control. It is what it is based on your anatomy, period. They can have an idea of what it will come out with, but there is no guarantee, absolutely zero guarantee as to what your size will be if you're gonna go the forearm route, all right? So you cannot pick it. Let's just put it out there, that myth, you can't pick. At least not to today. Maybe sometime in the future that could change, but as of right now, you cannot. When you go ALT route, which is using your thigh as a donor site for your phalloplasty, you do have the option to really put in perspective what length you want, but you do not have any control to what your girth outcome will be. And the girth is the circumference, right? The thickness behind it. What really stirred me away from ALT, because I was so gung-ho about going ALT route, and I'm like, oh yeah, this is what I know what I'm gonna do. I even had some electrolysis consult just to get a feel of what it felt like, and I had my thigh as a site. So I was really ready to go and just do the thigh, and then suddenly after my consultation, I quickly realized, wait a minute, I didn't think through some of these things that I had no clue about, and I'm glad I really sat there and thought, because I'm telling you, making the decision is huge. It's not necessarily about the cost that drove me from one direction to the other, but it's the amount of surgical time, and regardless, the lack of control that you have anyways. So the reason why I decided not to go with ALT anymore is mostly because you do have to go through far more surgical procedures to finally get the outcome you are looking for. When you have ALT, your thigh is thick, and so 9 times out of 10, I'm almost guessing more like 9.9 times out of 10, you're gonna have to have some debulking. Debulking means is when they liposuction your phallus, and you have to wait 6 months after your procedure to get the debulking, to get the size down. After phalloplasty, it's gonna come out thick, and as far as the circumference, you're looking at anywhere between 9 to even 10 inches thick. That is freaking thick, and you cannot do anything with that, okay? So you'll have your surgery, you'll have to wait 6 months, you'll get it debulked, and you would hope that that's enough to debulk it to a size that you're okay with, but sometimes it might not be. Sometimes after only one debulking, it might get it down to about 6 inches in diameter, and it may not be something you're comfortable with. And so you'll have to go through another 6 months wait, and then another debulking, and then finally you'll have the rest of the procedures done, and then you'll have to wait X amount of time anyways to have an implant done if that's a direction you're going. So your surgical downtime for ALT, you're looking at a total of an easy 2.5 to 3 years. More realistically, 2.5 to 3 years, okay? From start to finish, and that's assuming you're doing an implant. If you're not doing an implant, you're looking at minimum about 2 years. For me personally, I can be very impatient in this manner where I don't want to have to go through all that continuous back and forth, the visits, having to worry about accommodations and I travel and situations like that, so RFF is certainly hands down far more appealing because you can have the surgery one and done, 90% of the time. And then your follow-up surgeries are, 6 months later, you get the testicular implants. And then about another 6 months from there, you can get your implants. So from the start to finish, you will have your implant and you'll have your Phallos, everything done. No debulking is required when you do RFF. So for me, I'm like, damn, all of that all in 1 year versus 2.5 years and going through all that extra stress and agony. And to be truthful with you guys, when it comes to the size, although I have no control and I am running the risk of, being unhappy with an outcome of having a smaller phallus, it's just one of those where there's a stronger chance, a 97% chance that your length is going to be 4.5 to 5.5 or greater when you do a forearm. Okay, so that's already a really good size and is actually technically above average from cis men. It's just the reality where it's like, I'm not here trying to carry around a good 7 inches of phallus, so why would I want to go through all of that hassle going ALT? Because you need to think about this. Think about the fact is, when you have phalloplasty done, we are showers, not growers, right? So we are not going to grow and shorten like a native man would. So in this case, what you got is what you're going to have all day long. And where are you going to put it? That's what made me realize, shit, I really need to reconsider which direction of bottom surgery I want to go, because where the hell are you going to put it? You got to be really smart about this, right? And on top of that, the weight, where are you going to put it? All right, I'm sure some of you are thinking in your damn pants, right? I get it, because I was exactly the same way at first. I'm like, my fucking pants, where else am I going to put it? But when it's that much length to carry around all day long, that's a lot, all right? That's a lot to work with. So where are you going to put it? On top of that, the extra surgeries that it's going to take to get your outcome, your final outcome, which can also go with cost that it's associated. It's about 3 things there. And let alone anatomically, I much rather have something that just feels and looks more natural from the beginning than to have to go through all this process just to get it down a size. Right? This is my perspective. This is my opinion, because I was really struggling between which one to do. And if you guys are in the same boat, I would like to know. And if you guys made a decision for either or, as a matter of fact, if you made a decision to do ALT, please let me know. What was it that, made you feel, I'm just going to go the ALT route. I get it. Size is important, but it's not everything. There's so much more behind that. And the truth is too, the thickness of your thigh tissue is heavier than the forearm. So you're going to be carrying far more weight going the ALT route than you would the forearm. Plus the complications rate for going ALT, that's another 4th reason there. Complication rate for going ALT is a little bit greater than you would your forearm route. So you guys let me know, what are your thoughts if you're struggling with making a decision. If you have questions about the process or things that I may have asked during a consultation, just leave it in the comments and I'll be happy to make a separate video or answer your guys' question. But thank you for staying tuned. I will talk to you guys again soon. And don't forget to hit that like and subscribe. See you guys later. Bye.